who works on products, vaccines, and research.
WHO has warned that the COVID-19 virus has been changing since it was first reported, and it continues to change. So far, 4 variants of concern have emerged, and there will be more as long as the virus continues to spread. The rise is also driven by increased social mixing and mobility, the inconsistent use of public health and social measures, and inequitable vaccine use. Hard-won gains are in jeopardy or being lost, and health systems in many countries are being overwhelmed.
As always, should click icon raise hands to get.
Since our last press conference, cases and deaths from COVID-19 have continued to climb. Almost 4 million cases were reported to WHO last week. And on current trends, we expect the total number of cases to pass 200 million within the next 2 weeks. And we know that is an underestimate.
Question, if possible, only one question, so we can get as many as possible.
On average, in 5 of WHO's 6 regions, infections have increased by 80%, or nearly doubled over the past 4 weeks. In Africa, deaths have increased by 80% over the same period. Much of this increase is being driven by the highly transmissible Delta variant.
Interpretation in 6 UN languages. Also in
the Delta variant is a challenge, as the other variants have been. But remember, the diagnostics that we have all around the world still work very effectively against all of the variants, and we can detect the disease quite successfully. And in terms of vaccination, the vaccines that are currently approved by WHO all provide significant protection against severe disease and hospitalization for all the variants, including the Delta variant. So it's important. We are fighting the same virus, but a virus that's become fitter and better adapted to transmitting amongst us humans. That's the change.
Use any of these languages to ask their question.
There are no golden silver bullets here. There are no magical solutions. There's no magic dust. It's been the way for the last 18 months, and people keep asking for magic dust. It doesn't exist. The one magic dust we do have is vaccination. Problem is, we're not sprinkling that evenly around the world, and we're working against ourselves. So from that perspective, Delta is a warning. It's a warning that this virus is evolving, but it's also a call to action that we need to move now before more dangerous variants emerge.
General and the lead on ACT Accelerator. First question.
Do you really accept 1.5% vaccination in Africa, while in some countries it's already 70%? Don't we need a platform like the Olympics to go and tell the truth that the world is actually morally, epidemiologically, and economically is doing the wrong things? Is it really wrong to go to the mountaintop of the Olympics to call for solidarity? Are you saying that's wrong? I hope not. So that's why I went.
BC. Don't unmute yourself, please.
Hi, and thank you for taking.
And what we have seen from what Japan did is it did its best, and IOC, of course, they did their best to minimize risk, because nobody should expect zero risks. There will always be a risk, and there is no zero risk in life. So I know that they have done their best, and we have supported them all along.
In the United States, the Delta variant, U.S. health officials have.
And yes, there have been a number of new cases in the last 24 hours, and as there have been cases, through the Olympics, there have also been, I think, over 3,000 cases in Tokyo in the last 24 hours, and more than 10,000 in Japan. So the Olympics is part of that overall context, and the risk management that's in place around the Olympics is extremely comprehensive.
It's definitely more contagious, but there's also some evidence that it may